For the ELI's test, the patient will be supine, and I just passively flex their knee to their butt on both sides. And if their hip pops up, that's a positive for tight rectus.
All right, for ELI's test, there is no other name. It tests the rectus femoris. A positive would be if the tested hip comes off the table and flexes. The patient positioning is prone with their hands by their side, and I would stabilize the opposite pelvis. The stress point would be the distal lower leg, and I would passively flex the knee. A possible compensation is rolling over.
All right, for the Kendall's test, the patient is barely sitting on the edge, and she's gonna fall back and grab both her knees. She's gonna let one of them fall. And if the thigh is raised up with the leg extended, that's both iliopsoas and rectus. If the leg is parallel and kicked out, that's just rectus. And if it's anywhere out lateral, that's IT band tightness. So she'll pull back up and release the other one. And same thing on the other side. On her, maybe some IT band tightness, but barely.
All right, for Kendall's test, also known as the rectus femoris test, it tests the rectus femoris, iliopsoas, and IT band and TFL. A positive would be if with knee flexion less than 45 degrees with hip extension is rectus femoris. Knee flexion greater than 45 degrees with hip flexion is iliopsoas. Knee flexion less than 45 degrees with hip flexion is both rectus femoris and iliopsoas, and if there's any abduction, that's IT band and TFL. The patient lays supine with both legs tucked, and then relaxes one and extends the leg. There's no stabilization or stress point, and the movement is the patient just sits at the edge of the table, rolls back, grabs behind the knees, and tucks their legs, and then releases one, and then pulls it back up and releases the other to test both. There is no compensation.
All right, for Ober's test, the patient is laying on their side opposite of the one I'm testing. I would stabilize the pelvis and the hip. I would abduct their hip and bend their knee a little bit, relax. And if I, with my hand here, if I let go and their knee drops, that's a negative. If their knee stays up here when I release, that's a positive. I could also extend their knee and flex their hip a little bit and adduct their leg. And if I can get the testing knee parallel or even with their opposite knee, that is a negative. If I cannot adduct all the way down, that's a positive. I would do both sides, but I'd be in the way of the camera, so we're gonna do the one.
For Ober's test, there is no other name. It tests the TFL and IT band. A positive would be if the top thigh or the tested thigh and knee does not reach parallel or reach the other unaffected knee. The patient positioning is side lying with the affected side up. We stabilize the pelvis. I'm holding on to their distal lower leg, and I can support their knee with my hand, keeping the knee straight. The movement for this test is I passively abduct the hip and bring it into a little bit of extension, and then passively adduct the leg. And like I said, if the tested knee reaches parallel or reaches the other unaffected knee in line with it, then that's a negative. There are no compensations.